really looking forward to that resource, as many of them are hoping to eat a little lunch between classes right now. Amazing. Thank you all so much for joining us today. I'm going to start with some brief housekeeping and then turn it over to our panelists. Hello, everyone. My name is Chris Marin. I am the program director with Washington Council of Lawyers and part of the team that is organizing DC Pro Bono Week for all of you this week. We are so excited to be a part of the ABA National Celebration this year, focusing on supporting communities. And as a part of that mission, we have focused our events on different ways that you can support your community and your neighbors as a pro bono in your pro bono work, including ensuring access to public benefits. Hence this panel. If you haven't already, please check out the full schedule of events. It is only Tuesday. We have so much more ahead of us. If you haven't already, please register for the Walk for Justice on Thursday. That is at Nats Park starting at 3 p.m. With the DC Bar Foundation, a major fundraiser and grantee organization in our community that ensures that our public interest community can receive the financial benefits that they need to make sure that they can do the incredible work that they do. So a fantastic cause to ensure access to justice, and we hope to see you there. With that being said, I am now going to turn it over to our incredible panel, starting off with Robin Griffin from the Legal Counsel for the Elderly. You're muted, Robin.
Thank you, Chris. Good afternoon, everyone, and thank you for joining us. Today's panel will highlight the critical role public benefits play in our clients' lives, as well as the systemic barriers that too often stand in the way. You'll hear from Jennifer Mezzi of the Children's Law Center on the broader landscape of public benefits, Janice Hunter of the DC Bar Pro Bono Center on challenges within Social Security, and Allison Mousley of Bread for the City on DHS cases, each underscoring how pro bono advocacy can make a real difference. If time allows, I'll share some ways you can get involved with legal counsel for the elderly, and then Chris will lead us into Q&A. With that, let's get started. Jennifer, I'll hand it over to you.
Great. Thanks, Robin. And thank you to the Washington Council of Lawyers for having us and for recognizing the importance of this issue in our clients' lives. My name is Jennifer Mezzi. I'm the Deputy Director of Healthy Together, which is the Children's Law Center's medical legal partnership, where we work with medical providers in pediatric clinics all throughout the district on areas of healthy housing, access to education for children with disabilities, SSI, access to health, and other public benefits issues. So my job is to sort of talk about the landscape of public benefits. The bottom line is not very good. And what recent changes have been happening and what the impact of these changes are and are likely to be on our families. And then just a brief overview of how pro bono can help. And then I'm going to turn it over to Janice and Allison to talk more specifically about specific types of cases that pro bono attorneys can work on. So overview of changes. DC is an expensive place to live. So whether you're a low or moderate income family, public benefits are essential to meeting your basic needs. And the district has, until recently, had a strong commitment to providing public benefits to not just the poorest of the poor families, but families with more moderate incomes. And they haven't completely walked away from that, but there's certainly been been cuts that are going to be hard for families, some of which are compelled by the federal government, some of which DC is doing on its own. As a result of these changes, could you go back for a sec, Robin? As a result of these changes, and likely other cuts to come, you're going to find two phenomena occurring. First, there are going to be fewer eligible individuals and families for benefits. But in some ways, the bigger harm is going to be to the families who remain eligible and are doing what they need to do in order to get and keep their benefits. But because of all of the extra hurdles and barriers that are going to be put in place and the strains on government services, eligible families are going to end up losing benefits that they would otherwise be eligible for. And that's when you hear about the Congressional Budget Office's estimate of the costs of the One Big Beautiful Bill Act, that's built into the cost, that eligible families are not going to be able to maintain benefits. Okay, thanks. Next slide. So I'm going to talk about a few specific programs. And again, Janice and Allison will follow up with more detail. But this chart produced by the Center on Budget and Policy Priorities, I think, tells a lot of the story with Social Security. So if you look all the way on the right, the number of Social Security beneficiaries over the last 16 years has increased by 28%. While the customer service budget has decreased by 23%, and even more alarming, the number of staff has decreased even more, particularly disproportionately in the last year as a result of DOGE and buyouts and other things. So it's really sort of a perfect storm of more people needing assistance, less money to provide that assistance, and fewer people to offer that assistance. Next slide, please. And so what we're seeing in Social Security and SSI is that there haven't been any sweeping eligibility changes yet, but there are definitely some policies that will result in cuts that are being talked about. But what we are seeing is, as I said, fewer workers who are staffing offices or the phones, and that's especially heightened in the government shutdown. This is the irony of DOGE, that actually Social Security technology desperately needed updating and needed to be improved. You have people who are working on 3 or 4 different systems in order to do anything. And then the administration has also implemented anti-fraud requirements that are resulting in fewer services that can be done over the phone and pushing people to be online or go into offices. But not, as we all know, our clients sometimes find it difficult to conduct their business online. And then there's a perennial problem with either lack of notice altogether or notices that just don't explain well enough how to keep your benefits. Next slide, please. So as I said, DC for many years has had a really admirable commitment to ensuring that, roughly speaking, if you're a child with income below 300% of poverty or an adult with income below 200% of poverty, regardless of your immigration status, you will have access to health insurance through the Medicaid program, which is federal, state, funded program, which has income and immigration requirements. And then for adults and children who don't meet those immigration requirements, the Alliance program for adults and the Immigrant Children's Program for kids. Next slide, please. So as the result of the Big Beautiful Bill Act, this is from Center on Budget, but using CBO analysis. Over the next 10 years or so, there are going to be about 10 million people who are going to lose their health insurance coverage. The vast majority of that is going to come from people losing Medicaid. Next slide. And then these are the changes that are going to be happening in DC. So starting October 1st, there were new immigrant restrictions, and the big change was to the Alliance program. So as of October 1st, there are no longer any new enrollees in the Alliance over age 26. And for people who would still be eligible for who remain in the Alliance, if your income is above 138% of poverty, you're no longer going to be eligible for benefits. The other thing is that the district is also ending the immigrant children's program and putting all the kids into Alliance, so that eventually by October 1st, 2027, there will no longer be an Alliance program for adults. The Alliance is only going to serve children between the ages of 0 and 21 who don't meet the Medicaid immigrant eligibility requirements. The other big change that's going to happen is that as of January 1st, the Medicaid eligibility limit for adults is going to decrease as well. So kids' eligibility limits are going to stay about the same, so about 300 or so percent of poverty. But their parents or their childless uncle are going to have a dramatic decrease in their income eligibility. And we know the data shows that when parents lose coverage, it's harder for kids to maintain their coverage as well. And then by January 1st, 2027, federal work requirements will begin. And that's gotten a lot of attention in the media. And then there will also be some immigrant eligibility restrictions. And then finally, also on January 1st, 2026, adults who are between the income of 138% of poverty and 200% of poverty will be moved into a program in the exchange called the Basic Health Program. So this is sort of a Medicaid lookalike. There's no cost sharing. There are no premiums. The coverage is similar to Medicaid, but definitely not as good. So there won't be coverage, for example, for dental and vision care, which will be difficult. And again, even if adults are supposed to be in basic health, we always worry about whether they will actually get in and whether they will understand what their health insurance is. Next slide, please. And of course, we also are going to be losing federal support for the SNAP program. SNAP provides food assistance for low-income people, and DC, the federal government in DC had been taking lots of steps to expand SNAP eligibility. So there are basically 4 things that are going to lead to fewer people receiving SNAP benefits. There's going to be cost shifting so that states have to bear more costs of the SNAP program. The district has long had a waiver for implementing work requirements that are tied to time limits for adults. DC is going to have to implement those, and that's going to cause people to lose coverage. There are immigrants who are going to lose coverage based on their status. And the Big Beautiful Bill Act also undid an initiative of the Biden administration to increase the amount of the food stamp benefit to account for the rising cost of food. Next slide, please. And then finally, the district government is proposing cuts to the TANF program. So TANF is welfare. It used to be aid to families with dependent children. And what the district has proposed, which is on hold for at least a year, is that they're going to increase the sanctions that are on families who don't comply with work requirements. They're going to reimpose a 5-year time limit so that families who receive TANF for 5 years or more will receive a lesser and eventually no benefit. The kids will still receive a benefit, but obviously a cut to the parents is a cut to the whole family. And it would eliminate the cost of living increase for TANF benefits, so that the benefits still weren't keeping pace with inflation, still wouldn't bring you much above 20%, 30% of the poverty level, but now that will be even worse. Next slide, please. So, as I said, the impacts are not good. Fewer people are going to be eligible. Even eligible people are going to find it harder to get and keep benefits. There's going to be a lot of confusion, lack of information about what the rules really are, which will likely discourage families. And all of these massive changes are being made with not only no additional funding for staff and technology, that funding is actually going to be decreased, or at the very least remain level. So it's pretty bleak. Next slide, please. Okay, so here's the slight ray of optimism in this whole thing. Next slide. So the fact is, I should just say you should not need a lawyer to get public benefits. The fact that you do is sort of an indictment of system, society, whatever. We could have a long conversation about that. But given that that's not the world we're living in, getting help from a lawyer, in some cases, paralegal or someone else, can really make a difference for families. You can complete and submit applications and follow up on them to make sure that they get approved. You can help appeal erroneous denials and terminations, which are much more likely to happen in times of constricted resources. And you can explain to families whether or not they're eligible. Like if a family is no longer eligible, it's not a good use of their time to keep applying and appealing and going back to the agency. So you may not be able to get them benefits, but you can at least help them figure out how they're going to manage without. You can also navigate agency processes with them. You can communicate with the agencies so that the family doesn't have to keep going back. And then in some ways, I think the most important thing is just talking, once you've done these things, talking about your experience. The fact is that policymakers generally are thinking they have lots of considerations on their plate, and they don't always listen to the people who are the most impacted by these changes, which they should. But what we can do to help is we can help amplify their voices and talk to our friends, our colleagues, our family members about what is happening and how these changes are impacting real people. And that is it. So Janice is going to cheer everyone up, right?
Thank you. Thank you, Jennifer. And I don't know if I'll be cheering anyone up, but hopefully we can suggest ways that folks can help us do this work. Again, I'm Janice Johnson Hunter. I'm a pro bono support attorney with the DC Bar Pro Bono Center, the Advocacy and Justice Clinic, which is our full representation clinic where we match eligible clients with pro bono attorneys. I just want to note that it's an honor to celebrate pro bono work with Pro Bono Week with you all. I certainly believe that Pro Bono Week highlights the very best and the highest standards in the legal profession. And it's great to share the stage with Jennifer and Allison. All of our organizations do a tremendous work to champion the rights of our clients, but we cannot do it alone. We need your help to help us to access justice and provide access to public benefits for our clients. I'm going to share a little about my work with the DC Bar Pro Bono Center, the barriers that people face in applying for federal Social Security benefits, and suggest how you can use your legal talents and skills to create and preserve economic security for DC residents. The DC Bar provides free legal representation to eligible clients. Again, as we match pro bono clients with eligible with our pro bono volunteers. I focus on public benefits, but we also place cases regarding housing issues as well as family law issues. We recruit our attorneys. We provide training on Social Security law and practice. We provide ongoing support during the time that you are representing a client. And next slide, please. Who do we serve? Like many of our sister nonprofit law firms in DC, we do have income limits to the people that we serve. Here at the Pro Bono Center, we limit eligibility to 300% of the federal poverty guideline. However, most of our clients are well below 300%. Next slide, please. Why is this work important? Current numbers place residents living in poverty at between 94,000 to 100,000 residents of DC. DC's Black and Latino communities overwhelmingly suffer from negative and inequitable health outcomes due to unsafe, unsanitary housing, unstable work, and denial of public benefits. And so these inequities often result in mental and physical impairments. Next slide, please. This slide just represents a sort of a picture of the disparities by ward. If you look at the population in DC, it's a little over about 800,000 people. You see that there is an intersection between disability and poverty. And this is really starkly visible when you look at Ward 8, which is a predominantly African American community, which has the city's highest poverty rate at about 26.8%, and also the highest rate of disability at 17.3. In contrast to that, if you look at Ward 3, which is predominantly a white community, it has the lowest poverty rate at 7.46%, and it has a disability rate of just 7%. So these disparities reflect deep systemic inequities. It underscores the need for targeted legal services for residents living with disabilities in high poverty communities. Next slide, please. This is just a little picture to show that everybody is impacted by Social Security. From the minute a baby is born now, you're applying for their Social Security number. And that number is going to follow them all the way through into the end of their life. I'm sure we all know people who may be retired, and receiving Social Security benefits, or they're receiving survivors benefits, or they're receiving disability benefits. And all of us, probably, if we're working, we are paying into the Social Security system. So this system is something that impacts us all. Next slide, please. Just a little brief history. The Social Security Act was created as a safety net for Americans who did not have income. It sort of followed 1930s when there was the crash, and Franklin Roosevelt in 1935 created the Social Security Act and the retirement income system, which has grown now over the years. We now have something like 73 million recipients nationwide. And in the District of Columbia, 84,000 recipients in DC are receiving benefits. That includes 22,000 folks receiving SSI. Next slide, please. Again, it is a safety net program for those who are unable to work, primarily the elderly, the retired, people who are unemployed due to disability, surviving family members who depended on a worker to earn their income. The two programs that I practice in the most deals with Social Security disability, the disability insurance under Title II, and supplemental security income, or SSI, under Title 16. Also, children and widows and widowers are often eligible for survivor benefits if their parent dies or their spouse dies. And then SSI, of course, is also available for adults over 65 with limited income and assets. Next slide, please. Now, these programs share some similarities. They're all administered by the Social Security Administration. Each program has specific eligibility requirements. You have to physically file an application with the SSA. They're not going to call you and say, did you know that you're eligible for this benefit? No, you have to go and you have to apply for it yourself. Once you file the application, it is Social Security that determines your eligibility for any of their safety net programs. And then if you are denied, there is an appeals process to challenge either a denial, or if you receive benefits, a reduction or termination in benefits. Next slide, please. Again, Social Security disability insurance benefits is based on a person's earnings record. So if you have worked long enough, you may be able to apply for what they call Title II benefits when you become disabled. And then supplemental security income is also payable to eligible adults, but you do not have to have an earnings record. Next slide, please. And just a quick review of what is a disability. It's the inability to work. That is Social Security standard for what is disability. It has to be a medically determinable physical or mental impairment that can be expected to result in death, or which will last or continue at least 12 months. Next slide, please. But what is not a disability? Just having a medical condition is not a disability. If you are unable to find work due to economic or other factors unrelated to your ability to function in a workplace, that's not a disability. Getting fired or laid off is not a disability. And if your impairment is solely due to substance use, it is not considered a disability. Next slide, please. I just also want to underscore that children are eligible for SSI disability. Children from age birth to 18 years old, and oftentimes families are unaware that children might be eligible for disability benefits. So these are the kinds of things that we always want to, when we're working with families, when we're working with people, to ask that extra question to find out maybe a child would be eligible for benefits. Next slide, please. Again, just reviewing the survivor benefits, and folks eligible for that can include the wage earner's children, a surviving spouse, a surviving divorced spouse if they've been had been married at least 10 years, and sometimes dependent parents. Next slide, please. All of these applications have one thing in common: notices of denial. Next slide, please. And these notices of denial, oftentimes, even though Social Security is considered to be non-adversarial, and as Jennifer said, you should not have to have an attorney to qualify for a safety net program. Unfortunately, there are a number of common challenges that we find. Some of them are administrative. For example, if you're trying to contact your local Social Security office so that you can apply for benefits, most people say, I'm going to call the Social Security office. They call the Social Security office, the phones ring and ring unanswered. Or if it's answered, you'll maybe holding for anywhere from 15 minutes to over an hour. And then sometimes you'll be disconnected. Walk-in appointments now are being discouraged by Social Security. And these are some of the changes that, Jennifer mentioned, that folks used to commonly walk into the Social Security office because everyone isn't able to manage discussions by the telephone or going online. But those are discouraged. Local field offices are understaffed. We saw the huge decrease in staffing at Social Security. And this is really playing out in the 3 local offices in the District of Columbia, one in Anacostia, one at Postal Plaza, and the 3rd office, which is on D Street Southeast. And which Social Security office you use is pretty much determined by your mailing address. The technology is inadequate. The phones, the online applications, which was supposed to be such a great innovation, particularly during the pandemic, has never really worked out, particularly for people applying for SSI. So you still have to contact the local field office. Some people don't have access to a computer or they have trouble navigating online systems. Another challenge for clients is that Social Security constantly gives inaccurate information. A person calls with a question, am I eligible for survivor's benefits? How do I apply for disability? I got a letter terminating my benefits. How can I correct that? And they get inaccurate information. The actual Social Security staff, they have very little understanding of due process rights and individuals' rights to appeal. And even if they might be a little late, they can still file an appeal with a good cause statement. And oftentimes people are turned away. You missed your due date. It was yesterday. Go back and file a new application. And with so many new staff joining the offices, there's a lack of understanding of a very perplexing administrative system. I was told one time by a manager that it takes a new employee maybe at least 5 years to understand all of the programs and all the nuances. And so folks are getting wrong information all the time. Now, for the client, once they apply for a benefit, it can take at least 36 months to ultimately work through the system, oftentimes longer. We've just had a pro bono case that is finally completed after 7 years. In that time, that individual has lost their home. They don't have any income or very, very little income. Jennifer mentioned the deterrence, the so-called fraud deterrence, which is now creating delays in service. Social Security sends 3 and 4 page letters that, as a trained attorney, I'm scratching my head trying to figure it out. For most people, when they get these letters, first of all they can see is the big 0. Your benefits have been reduced to 0, and they cannot understand why. Or it says that your application has been denied, but the reason is nonsensical. So they get these unclear written notices. They're confused. You would get confusing timelines for appeals. It's not unusual for someone to receive a letter today and it will say, you must call our office by October 17th. Well, today is the 21st, right? It's the 21st. So, it creates more anxiousness for an individual. SSA is notorious for making telephone appointments since they don't want you to come into the office now. And you sit there waiting by your phone and Social Security doesn't call. However, you may get a letter the next week saying you missed your call and we are closing your case unless you contact us again. If you are fortunate enough to win benefits, hooray, the payments are not processed. It can take months for you to get your first check. Next slide, please. I also want to address negative, implicit, or explicit biases that folks often encounter when they try to contact the Social Security office. When someone applies for benefits, usually they are at one of their lowest moments in life. They don't have income. They can't work to get income. They're broke. They're often living in undesirable places, or they're homeless, or they're soon to be homeless. You know, they try to call the office. They're waiting on the phone, using up their valuable telephone minutes that might expire by the end of the month when they're all used up. They're getting angry, they're getting upset, they're in pain. Um, Oftentimes, folks have behavioral disorders. And then once they get to talk to someone, they're not using the magic words, they're not using the right lingo. Um, they don't know how to explain what it is they need. All they know is they've got an application pending and they haven't heard from anyone, or they've received a notice that their benefits are terminated and they don't know why, or those benefits have been reduced and they don't know why. So they're angry. On the Social Security side, they're understaffed, they're hurried. They often lack patience just due to what's going on in their individual offices or other internal frustrations. And all of these issues seem to cascade down on the person who is just trying to get their application in or find out what's going on after 6 months, 12 months, eight months or more. And on this slide, it lists some of the things that influence how clients are often perceived when they come into the office. Their educational attainment, their work history. If someone has never worked, it's not unusual. I have heard workers say, well, I've been doing this a long time, and if no one has worked, they're just trying to get benefits. So they are already, us making assumptions. A person with limited English proficiency or cannot explain exactly what they need, there's little tolerance for that. And even though Social Security is required to make sure that translation services are available, unfortunately, it's not unusual that folks will call and they are unable to get any assistance due to the language barrier. Someone who comes in and they just don't look right, they don't smell right, they are not perceived as someone who needs assistance. People with a history of incarceration, and those benefits should almost be in place by the time a person is released, but oftentimes that doesn't happen. A person who might come in and smells of alcohol, again, they're saying this person doesn't need our assistance. Next slide, please. And this is exactly where you as a pro bono volunteer attorney can make a difference. And access to justice cannot happen without you. In the District of Columbia, over 3,000 people apply a year for various benefits, and 2/3 are denied. That is a whole lot of people who need assistance. That is not even counting those 84,000 people who are already receiving benefits, but may receive notices of termination, notices of overpayments. So it's critical that I think if every nonprofit law firm was able to stretch all of their resources, we still would have not have enough attorneys to do this work. It's a lot of work. And cases for clients with limited income are rarely represented by the private bar. Our programs and the pro bono work is for those folks who are pretty much considered the poorest of the poor, those who can really benefit from these safety net matters. Again, pro bono matters. An attorney getting on the phone with that client who could never communicate well with the Social Security staff. Just having that attorney on the phone to call and say, hello, this is Janice Hunter. I'm representing Jane Doe, and I'd like to talk to you about their application and find out the status. The whole tenor of the call changes. All of a sudden, the staff are usually wanting to, check the computer, let you know the status, give you their name and phone number even, so that you can connect back with them. It's those kinds of things where your legal skills and talents can really make a difference. Social Security is an administrative practice that has 4 levels of administrative appeals. I've talked about the letters. Everyone needs an attorney to work through this system. Support and training through the Pro Bono Center, we are able to provide that for any volunteer attorneys. Next slide, please. And there, the QR code, you can scan that and find out more information about our Pro Bono program. Thank you so much. I just want to encourage you, and I just want to share one thing. A client received this, a pro bono attorney received this note today. A client wrote, my life has changed because of you. I feel somewhat whole again. Winning my case would not have happened without you. Simply said, thank you. I can be happy again. Thank you, and I'll turn it over to Allison.
Great, thank you so much, Janice. So I work for Bedford the City. I'm a managing attorney there. You'll see on the screen the other programs that Bedford the City has to offer besides legal services. So we're a holistic organization. And I'm going to talk about switching back to DHS benefits, the Department of Human Services administered benefits, the types of issues that we typically see in our legal clinic and that we would be able to potentially refer to pro bono attorneys. So a big one is, and I'm going to get more into this, clients are not able to maneuver District Direct, which is the online system, both a blessing and a curse, right? DHS had no online option before the pandemic. People had to go and line up and wait for 5 hours in line to get to see anyone. So good that they developed something. It's really, really hard to navigate for folks that are not computer savvy. And there's system glitches within District Direct. So even if you're an attorney trying to assist with applying for benefits or recertifying, you're bound to encounter problems that require follow-up with the agency. We see erroneous denials of application for benefits. There's some sort of wrong information in the system that we need to dig into. Wrong amount of benefits are awarded. Terminations for various reasons. So alleged failure to complete a mid-certification report or a recertification, because of course, once you apply for these benefits, you don't just keep getting these benefits until you're no longer eligible. You have to routinely recertify, renew. For food stamps, it's twice a year. For TANF and medical insurance, it's once a year. And if you don't recertify, you're going to lose your benefits. We see documents lost by DHS, which is why we really recommend that people do not mail in documents and don't go in person to drop documents. So this is kind of the paradox here is there's so many problems with District Direct online and it's so difficult to navigate. But at the same time, we really don't want clients going into DHS because they lose documents so often and they don't provide receipts. So there's not going to be any way to prove for a client to prove what day they went in, what they dropped off if they do it that way. We see people have action taken on their case, but no notice was sent ahead of time. So even if DHS is correct and someone missed their recertification for TANF, they did not recertify in time, if they don't send a notice saying you missed your recertification and now you're being terminated, they have to go back and reopen the TANF to give them a chance to do the recertification. So really critical to track that notices are being sent before action is taken. As Janice was mentioning, DHS also has a requirement to provide interpretation and translation into certain languages. We regularly see that they're not doing that. And a language access violation can be on its face proof that no notice was given because a notice was given in a language the person doesn't speak. Particularly urgent issues that we're seeing now are issues to do with the DC Healthcare Alliance. So Jennifer was mentioning this as far as one of the programs that has the biggest changes happening in DC right now. This is the health insurance is primarily for immigrants. We are seeing people, even though a lot of people are getting cut, properly because they've changed the parameters, they've changed the income limits, they're actually terminating people because they're saying they're over income under the new income limits when they're actually not. Or people are recertifying on time, they're not processing it correctly, and then DHS is saying, sorry, we're not accepting any new applications for Alliance because as of October 1st, no new applications for people over age 26. So those are kind of the particularly urgent issues that we're seeing now. All right, so now I'm gonna just in the next 5 minutes or so, try to walk you through District Direct so you have a sense of what it's like to be a person trying to navigate their own account. So everyone has who can create their own account on District Direct. This is the main landing page this is the main page after you sign in, and then you can click on your account, which is the next page. And this is the dashboard. So this is somebody's account. You sign up for an account using an email address, or you can even sign up if you don't have an email address. You create a password, create an account, and then you have to link it or connect it to your DHS account. And then you can actually interact with your DHS benefits. So at the top here, sorry, go back for just a second. At the top here, you'll see kind of to-do items. So red are alerts to the person that they have to do something. Green is letting you know that something has happened. And yeah, if people go on, they can just click on that recertify button, for instance, would take them into the recertification document. Okay, next. You can look to see if you have any applications in progress that you want to continue on. If you've saved them, you can click and see submitted applications. So that's a really good proof that something was submitted. You'll have that all there. You'll see everything that you put in. Okay, next. You can look and see outstanding verifications. So DHS on the other side can populate this and say, great, we got your application. Now we need proof of your income. Now we need proof of your address, things like that. And so it'll pop up as verifications due. You can upload items directly into that. Next. Even before the verification requests pop up, if you're helping someone apply for benefits or recertify, you can just go in and affirmatively upload the type of proof documents that you know that DHS is going to ask for. So that's there, and you'll have a proof timestamped of the date that you submitted it. And then my information, you can do other helpful things, report changes of circumstances, maybe income has changed, you've had a decrease in income, you've had a new baby born, and then you can do things like request medical cards through here. And then notices, you actually can see a list of all the notices that have been generated for the household since District Direct started. So going back to like 2021-ish, all the notices. And so notices still go out by mail as required by law, but they also have duplicate notices that go out in real time to District Direct. And so this is an example. When you click on the notice, the line for the notice, you can actually pull up the full PDF of the notice and read through it and see everything that was said to the client. Okay, so if you're working with someone and if everything goes great, you can get an application in, it gets processed. The client, you teach the client how to go in, how to check it periodically to make sure there's no notices that they need to read, to understand. But here, let me show you about how you can find problems in District Direct and potentially help them. Okay, so these are screenshots from a real client's District Direct. So I go into her account and I see 13 verifications requested. And so I say, why are there so many verification requests? Okay, click on the view details for that. Next screen. And I see, this is just the start of the list of verification requests. Nonsensical or irrelevant verification requests. So this is someone who is a non-citizen applying for benefits for their child. She does not have to show proof that she's a non-citizen. That's a self-attestation. She's not trying to get benefits for herself. It again asks for non-citizen status. So twice asked for shelter expense. Residency status, I think, was the only one that's actually legitimate, that she's a DC resident to be able to get better benefits for her kids. So I uploaded that one, ignored the other ones. Okay, next page. And then it shows other verification requests for other members of her household. They again make no sense. So there's verify social security number twice for a child who is a US citizen who's already in the system, as their social security number hasn't changed, right? It's already in the system. If you don't deal with all of these verification requests, the case will not be processed. The renewal will not be processed, and it just gets stuck right here. It's not going to go forward. Okay, next. And then you can also check and look at notices to see, okay, did something bad happen to your client's case and no notice was sent? So looking through to see, okay, their TANF got terminated. Like, let me look and see if there's a TANF termination notice there. If not, that's action that you can, some action that you can take. And then you can look through the notice itself to see if it's substantively sufficient. So this is an example of, okay, sorry. Okay, this is it. And then you can look and see, are there conflicting notices in there? So this is the first of 2 notices sent to the client on the same day. So this one says termination of medical assistance coverage because they did not receive a renewal packet. Okay, next page. And then we get, congratulations, your application has been reviewed and you qualify for DC Healthcare Alliance coverage on the same day. And then you have notices that on their face are not accurate. So this notice is in Spanish, but it says that the family has an income of $2,100, which exceeds the maximum of $3,697 $697 a month, which is obviously wrong on its face. So what you can do to help, like I said, you can help people create accounts on District Direct, gather their proof documents, complete the applications and research. If there's problems, disregard this, email dpo.deputy. They got rid of that email address. There's a new system called Submit a Concern that you can do online, where you basically, as an advocate, can go in for the person and say, hey, my client got 2 conflicting notices about their alliance. I want to know, like, are they approved or not, and what other documentation is needed? Someone on the DPO team at DHS will review it and get back to you and hopefully fix it. This is a system, and the Submit a Concern system is also not going to be an easy system for our clients to navigate. Just in the week and a half that we've been using this new system, we've run into problems with it, but it is a system that attorneys can navigate. So both District Direct and the Submit a Concern are things that attorneys can do. Attorneys can also aggregate examples of problems that they see across different clients and escalate those to DHS management so they understand there's a recurring problem happening in district direct. And then you can file fair hearing requests with the Office of Administrative Hearings if that type of informal resolution is not possible.
Thank you, Allison, for walking us through the DHS benefits. I just wanted to take a quick moment to share with you all some information on Legal Counsel for the Elderly, where we champion the dignity and rights of older adults in Washington, D.C. We would love for you to get involved. So if you are interested in taking on pro bono cases, please reach out to John Turner or Catherine, your guru, because again, we're thankful for you, your time, and your commitment to this work. At this time, I'm going to turn it over to Chris to see if we have any questions.
Amazing. First, thank you all so much for sharing your incredible expertise. We are getting a few questions in the chat. We have one that says, if attorneys are brand new to this field, does it take a lot of training to get them up to speed, and does that work well?
That is a great question, and I'm happy to start out by sharing, like Janice shared, there's a lot of training, a lot of support if you're interested in taking on the cases. Speaking from Legal Counsel for the Elderly, we offer mentors who are there every step of the way, guiding you through the case. So if you're brand new to public benefits, there's training offered, mentorship, and support.
Amazing. And it looks like folks are already answering in the chat. Thank you so much, Allison and Jennifer, for addressing our opportunities for non-attorneys. Are there available opportunities in this space? Allison says yes. And Jennifer also says yes with applications and with follow-up if other things. I'm sure that there are plenty of steps in the process that non-attorneys can support folks. Where might non-attorneys be able to reach out? Should they go through the same process as an attorney, or is there another process they should go through?
Sure. With Legal Counsel for the Elderly, you can reach out to John Turner or Catherine Yaguru, and the slides will be shared after, so you'll have their contact information. And then also feel free to reach out to Bread for the City, Children's Law Center, and the DC Bar Pro Bono Center to follow up for opportunities.
One of the things that we like to encourage at CLC is for people to work in teams. So particularly for an SSI case, which, like Janice said, can go on for a long time, you could have non-attorneys doing the investigation, gathering the records, analyzing the records, and all of that. And then if you need to go submitting the early documents, and then if you need to, you can go to a hearing. And have an attorney do that. And that way you can make sure that it's well staffed. I'll put the email address for Jen Massey, our pro bono coordinator, in the chat. At this point, we don't have opportunities for public benefits, but we are definitely working on those. So stay tuned for those to come.
Amazing.
Thank
and
you.
we will share all this contact information in the follow-up email, including Jen Massey. So no need to rush if you're looking for it, Jen. But thank you all so much for joining us. And if you have other questions, we'll be sharing the contact information for our panelists in the follow-up email, and you can reach out to them with anything that might be a little bit more detailed. With that being said, we are officially wrapped up on our public benefits panel. Again, a huge round of applause to our panelists for all their incredible insights. We will be sharing their slides, their contact information, and the helpful resources we've gotten in the chat, in the follow-up email. Again, if you're interested in taking on a pro bono case, you'll be absolutely supporting our neighbors here in the district. So we highly recommend reaching out and learning more. And if you're nervous, please don't be. You have all of these wonderful people to support you. With that being said, thank you all so much and have a fantastic rest of your day. We hope to see you at more events of DC Pro Bono Week.